Hi, everyone. Before we begin, I'll just share a couple of procedural things. You'll notice
Yeah.
that the chat function has been disabled. Throughout the presentation, please instead use the Q&A function to pose questions to our speaker. I and my colleague Jason are also here to support, and so at any point, if we see questions coming around tech stuff in the Q&A, we can assist you right away. We will also be making time at the end of the presentation for our speaker, Dr. Diebold, and myself to have a little bit of a dialogue around your Q&A questions. So please go ahead and put those questions in the chat throughout the webinar, and we'll make sure to come back around at the end of the webinar to answer those questions for you. You'll also be provided with a survey at the end of the webinar. It only takes a couple minutes to take, and we hope that you will go ahead and do that. That gives us a good sense of what you liked, what might help you access or enjoy the webinars more, and also what you'd like to see from future webinars. You will notice that this webinar is being recorded and it will be posted to our YouTube channel shortly after, within the coming weeks. That means you can revisit and share this webinar at any time, and you can also check out our previous webinars. After I'm done with the introduction, I will put that in the chat for you. Without further ado, welcome to the Alliance Against Violence and Adversity's Webinar Wednesdays. We are excited to be back. This is our first webinar of 2026, and we're off to a great start with such an amazing speaker. I'm your host, Dr. Sarah Yursich. With Ava, I'm an early career researcher and lead on the webinar series alongside my amazing colleagues, Andrea, Jason, Isra, and Alexandria, without whom this would not be possible. In addition to that, I am the co-director of the Frida Center for Research on Violence Against Women and Children, housed at Simon Fraser University, and faculty in the social sciences at Capilano University. I'm joining you today from the unceded, ancestral, and traditional territory of the Coquitlam First Nation, and on behalf of AVA, which is national, I want to begin by acknowledging that we encourage all Canadians and visitors to Canada to learn about the Indigenous peoples of the lands on which they live, work, or visit, and become engaged allies together. We, as Canadians, in the spirit of truth and reconciliation, respect the self-determination of First Nations, Métis, and Inuit peoples, and their rights, responsibilities in cultures, languages, and the pursuit of wellness. The focus of today's webinar is violence prevention as a public health imperative for South Asian women. We are joined by Dr. Alishau Diebold from Mount Royal University. She is an assistant professor at Mount Royal in the Faculty of Health, Community, and Education. Her work is grounded in social work practice and guided by the belief in power of the community and community-driven change. Built on foundations of interdisciplinary academic and professional training, her research advances violence prevention through the transformation of health, social, and legal systems. Alishau, thank you so much for joining us today. I'm so excited to learn more from you.
Okay, thank you so much for having me here today. Thank you so much for spending your time with me today as well. I'm just going to advance the slides here. Oh, just bear with me a moment. There we go. And so I wanted to start today with a land acknowledgement. So with gratitude and reciprocity, as a child of immigrant parents, I acknowledge the relationships to the land and all beings, the songs, stories, and teachings of the Zigzaga Nation, the Piikani Nation, the Kainai Nation, the Ithacastoni Nakota Nation, consisting of the Chiniki, Bearspaw, and Gastoni Nations, the people of the Tsuut'ina Nation, and the Métis. I recognize my responsibility towards reconciliation and am committed to continuous learning, reflection, and meaningful action. And so I share a photo of my parents here because my Indigenous mentors and teachers have taught me to express my land acknowledgement with a connection to myself and the land. And my parents, they fled Guyana, which was in South America, to avoid political conflicts and armed conflicts. And so they were part of the Indo-Caribbean diaspora to North America. And so they both settled here in Canada as a safe place. And so I'm just very grateful that we can be here today together to share this information. I can speak about this project, and I'm wrapped in this blanket of dignity, which my parents really shared with me and really encouraged me to pursue my dreams. And so that's how I came to be here with us, with you today in this webinar. And so just sharing a little bit more about my background in terms of my purpose. I'm a second generation Canadian here. I've worked both with federal, provincial, and municipal positions. I'm a social work practitioner, My background is in legal studies, and then I advanced to do my Master's of Social Work and PhD at Wilfrid Laurier University. And I'm someone who, as well as a registered social worker, and had a clinical practice as a private practitioner working with folks who had experienced trauma and violence in their lives. I enjoyed my PhD studies so much that I really pursued a position in academia and in education. And so I became an assistant professor here at Mount Royal University. And something that underlies my research and my advocacy and my practice as a scholar and a practitioner is artistry and art. I really do quite a bit of arts-based research, which you see here on the slides. This collective mural was done by a group of youth who were working through a different program in terms of increasing opportunities for health and education. And so the youth actually came together and designed and developed this mural. And they also painted it. And it's a collective emblem of their advocacy, their time together, and their collective learning. And so I believe strongly that art is an incredible way we can express ourselves and impact our communities and the broader world globally as well. My interest in terms of research is gender-based violence and institutional responses for violence prevention. So I'll be sharing more about my research and kind of future directions as well as we move through the presentation. And so I really value interdisciplinary collaboration, celebrating different perspectives, these creative and holistic practices, and arts-based research. And so today's presentation will really be focused on learning more about young South Asian women in Canada. We will really look carefully at violence prevention through a public health lens and discuss and learn more about how this shift from violence in terms of punitive responses can shift to be more as effective as a public health prevention mechanism. So we'll speak more about the tactics and strategies around how this shift can occur. I'll also speak more about our existing gaps in policies and services, and I'll share about more evidence-based frameworks and global practices. In the end, I really want to leave you just with the call for action and as well some practical tools for community action as well. And so as we dive more into this content, I did want to share a content notice. So we will be discussing topics related to violence, trauma, and adversity. And we will be speaking specifically about gender-based violence and intimate partner violence, harassment, and barriers to care. And so this information is really designed to increase our understanding and really offer recommendations for how we can come together as a group and a collective to offer more support. But I really encourage you to please take care of yourself while reading this content, listening to this webinar, and please step away or pause if needed. And so I wanted to start this presentation with a visualization exercise. And so I invite you to close your eyes for a moment and picture a young South Asian woman in your community. And so what do you see in your mind's eye? What does she look like? Where is she located? What can she see and hear and smell around her? Imagine her waking up, going about her day, interacting with family, peers, school, or work. And consider both her support systems and the challenges she might face. And these challenges may include risks of violence, social pressure, discrimination, and barriers to seeking help as well. So just take a moment to hold those images and those visualizations in your mind and really just take a stock of the different sensations that you may be experiencing or thoughts and those different pieces, maybe emotions are coming up. And so I'm going to encourage you to hold that visualization through our presentation and really center this person's living experience. And this will help us to really connect to and understand why culturally and gender responsive public health interventions are critical. And so as you're holding this visualization, imagine this person is experiencing gender-based violence. So to give you more of a background about what gender-based violence is, the definition I pulled from various researchers was around an act of violence that an individual faces due to their gender, gender expression, gender identity, or perceived gender. And there are different forms of gender-based violence. We see that violence emerges through physical forms, financial forms, psychological or emotional forms, sexual, technological, and spiritual. And so I want to sit here just a moment with a few different forms of what gender-based violence can be like. When we think of gender-based violence, often we initially think of that physical violence, that physical harm, where individuals are having this different type of really kind of like violent, action-oriented engages that are creating harm. We also see that in the South Asian community that there's significant economic harm in terms of access to finances, bank accounts, and financial means to be able to exit a difficult situation. There's also emotional and psychological forms where we see that women are shamed, blamed, and really spoken to in ways that manifest in terms of neglect or mistreatment. We also see that there's sexual um, violence as well, in terms of these types of issues, in terms of with no consent or being forced to be in a relationship, in terms of creating that physical contact. We also see technological in terms of not having access to different technology to communicate with others in terms of families and support systems, and spiritual, where folks may not be able to access as well the spiritual caretakers or spaces which they find relief in. And so, just giving you a little bit more context about what gender-based violence is and what forms it can take. And so, South Asians, I just want to share a little bit more about you about this population in the group. Our individuals with family origins in India, Pakistan, Bangladesh, Nepal, Bhutan, Sri Lanka, and the Maldives. And so South Asian communities come from a variety of different countries and nations. And today, this population in Canada is more diverse than in past and continues to grow. In the 2021 census, over 2.57 million individuals reported as South Asian in the census, making South Asians the largest racialized group in Canada. And since the 1996 census, the South Asian population has nearly quadrupled, and its share of the total Canadian population rose from 2.4% in 1996 to 7.1% in 2021. And so when we think about this, we really recognize that it's important to have this intersectional approach when talking about gender-based violence. And intersectionality, that theory was brought forward by Kimberly Crenshaw to discuss how different parts of our identities layer on each other to create different experiences. And these can be experiences of marginalization, increased social exclusion, discrimination, but we see that the more different types of identities that are interacting, there's different spaces and different forms where an individual may be experiencing violence differently and as an individual. And so we see as well that South Asian women have reported barriers when they're faced with accessing various services, exposure to combined levels of discrimination, and lack of physical access and resources. One of the other challenges that South Asian women experience when speaking in terms of reporting or speaking about an abusive relationship is that there are 300 different South Asian languages and multiple dialects. And so we're at the stage where we're building the language to talk about gender-based violence and what that means and how it's constituted within our families and different social architects. There was in different studies, I just want to move to the next slide here. And so speaking more about gender and cultural vulnerabilities, we really see that fear came up quite a bit in multiple different studies around as a major barrier to leaving an abusive relationship. As well, we see that other factors include folks not reporting or leaving the relationship around keeping family together for the sake of children, that there's no alternative housing option, that there's a strong emotional investment in family. Financial reasons was another major component. And we also see that when we ask about in terms of reporting to police, fear for safety came up as the most frequent answer. And so more systemic and familial factors were reported as barriers to leaving a relationship and reporting the violence than cultural factors. And so in terms of these pieces, when we talk about more about those systemic pieces, this is where that digital and social media comes into play. In terms of that familial factors, we thought we discussed trauma and how that may be compacted through re-victimization and criminalization. We recognize now as well that this based violence has intergenerational impacts. And so that's why we recognize the possibility and the impact of a re-victimization when individuals have to report experiencing violence and have to share more of their stories and share a significant history about what they've been going through. And so when these different pieces, topics related to violence come up, often what happens as well is that other mechanisms in our systems are triggered related to punitive mechanisms, legal responses, and a myriad of different types of areas where the women actually may experience more criminalization as a result of reporting that violence. And so we also see that there's this understanding of cultural constructs, myths, and stigma as well. And so when we talk about cultural constructs and myths and stigma, that fear of judgment, that fear of what may happen to my family, these kind of pieces emerge. And so one of the vulnerabilities that South Asian women experience within our social systems and within larger westernized systems as well is around those cultural constructs about violence and what that means within these contexts. And so they experience a cultural vulnerability in the sense that they have their own unique culture and they are embedded within a westernized culture as well. And so one piece I also wanted to flag was that there's just a great deal of diversity and intersections, even within Canadian South Asian identities. As I was saying before, there are many, many languages, many different regions. And so most South Asians are actually trilingual. They speak English, also Hindi, which is the national language, and their community language as well. And so there's just a lot of different ways that we need to address that cultural sensitivity and really be conscious of this diversity because there's just a lot of difference within the culture. And so when we talk about these vulnerabilities and some of these issues, we see that violence is not just a criminal justice problem. When we call police or we involve lawyers or legal systems or courts, we also see that this is a significant public health concern. It's been reported repeatedly in the scholarship and the literature that gender discrimination and violence contributes significantly to health disparities. Women report the most frequently identified intimate partner violence related mental health consequences. Some of these include post-traumatic stress disorder, anxiety, depression, insomnia, substance use and abuse. And there's also an emerging body of literature identifying traumatic brain injury as a result of experiencing violent encounters as well. And so, as a result of this research and this movement towards responding with health pieces or health initiatives or programs, we're shifting now to public health lens, which focuses on prevention, upstream prevention, interventions, and addressing root causes. I will speak more about each of these just shortly, but really wanted to summarize that this framing shifts this focus from punitive responses to health prevention, equity, and wellness. And so we move away from that criminalization and punitive mental mode to a mode where we're looking at health concerns, health responses, and prevention opportunities. And so, as we look at these different opportunities, as a researcher and as an early career researcher, I'm looking specifically at these responses and opportunities from a systems level. And so I look quite a bit at policy pieces, policy documents, how different systems are interacting. And this really links back to my social work values of really looking at a person as a whole and as well as looking at their systems as a whole. And so we see that there's different gaps in our policies in Canada. And so the scholarship indicates that there's just this lack of culturally responsive services for diverse communities, an understanding of how different folks would respond in this type of situation, and the type of relief or the type of responses that would be meaningful or effective or create a sustainable change for them moving forward. And closely linked into this point is around socio-ecological approaches and intersectional coordination in policies and programs. One of the main barriers in accessing the resources is that this response in terms of violence prevention requires responses from multiple systems, our health system, our social service systems, our legal systems, and our social systems, social framework systems as well. And so there's this recognition for our policies to be more holistic and focused on socio-ecological approaches, and as well as engaging different disciplines and different service professionals and practitioners and academics to be able to coordinate some of these policies and programs in a more streamlined and effective manner. And so what we're also seeing is that policies rarely integrate intersectionality or community-based violence prevention initiatives, which is what many of the researchers in this field are recommending or speaking about in terms of future directions for our research in terms of how we can create significant change and impact in this space. We also, it's one of those pieces, and when we talk about the South Asian community, one sentiment and one main factor is around crossing that threshold of fear. So in our policies and in our programs, we really need to be able to address the different needs of survivors or persons who have been harmed in crossing that threshold of fear and being able to understand perhaps in the future what different responses would unfold and some of the impacts of some of those decision pieces. So there needs to be a lot more clarity in our policies moving forward and building a level of understanding and certainty in terms of engagement and building trust. And so some of these public health frameworks for prevention that we're seeing more and more of and that we're seeing such success with is around upstream interventions. And so we are working towards preventing violence before it occurs. In the research and the scholarship, we see that many family programs and also school-based programs are really moving the needle in terms of providing education to this to a broadly about gender-based violence and specifically around cultural context and cultural sensitivity. And so we're moving in this direction now where we're providing education and interventions before violence occurs. And this is really taking more of a root cause approach. We see that when someone experiences violence, that there are health outcomes that we need to respond to. And so taking that public health response route can really create some positive change in this space. We also see that multi-sectoral or intercollaboration across health, education, community services, and law enforcement is so critical. We're seeing more and more at the front line and at direct service pieces or outlets or practices that when teams are working together, when teams are communicating and collaborating, that folks are able to really build a future and address past and present harms that they've experienced. We see this through trauma-informed interventions. We see this through community-based interventions. Folks need to be able to express their needs and have an active part in the decision making and creating that change in their lives. And so we see that when we work with folks directly who have lived experiences or are the service users, we see an incredible momentum and a sustainable change that happens generationally to break some of those cycles of harm. And so that community-based prevention in terms of engaging with families, schools, and cultural organizations is so critical for us to be able to build bonds, build collaboration, and really strengthen our communities across Canada. and just sharing some international evidence about some other violence prevention initiatives that are going on across the world. I've highlighted here for you today the UK, Australia, and New Zealand. And so we see in the UK that they have really mobilized and implemented youth-focused community programs to reduce radicalization risk as well as violence. And so it's one of those pieces. It really looked at unpacking some of the media and the social perceptions that are going on in the main media, and as well distilling through social media and news, these kind of pieces, the different kind of visuals and messages that our youth are being exposed to or hearing or learning, and really providing that intervention at the youth stage, at the younger stage, to be able to combat some of those perceptions and some of those issues and provide evidence-based information around violence prevention and what healthy relationships and healthy connection and creating that belonging can look like tangibly in the community. So it's encouraging youth to really link into their purpose, to their fulfillment, and it really focuses on the strengths of the youth and building their future forward in that way. In Australia, there was conversations and research done around culturally sensitive school interventions as well. And so creating opportunity for different students and different staff to engage in opportunities to explore diversity, difference, engaging with each other about different cultures, international symposiums, these kind of pieces really created that avenue and that mechanism for youth to really learn more about what's going on in the world and around the world, and really connect with different folks and different peers and starting to build those so positive social supports and relationships as well. And in New Zealand, these family engagement programs have also been shown to reduce domestic violence. And so we're seeing incredible changes and incredible learning across the world in this space. And so though gender-based violence is very prevalent, we're seeing that we're having incredible momentum in terms of in terms of this social movement to reduce gender-based violence and prevent it before it happens. And so I wanted to highlight this quote from Maya Angelou: do the best you can until you know better. And when you know better, do better. And so we've learned from many, many incredible scholars and researchers about the harms, the physical and health harms, outcomes of gender-based violence. And so now we're at a stage where we really want to do better and we're really moving forward. And this is the central praxis and point and purpose of my research, is really to try to develop and explore violence prevention interventions for South Asian younger women in Canada. And so using a gendered intersectional analysis model, my research really looks at systematically mapping and critically analyzing different policy frameworks. And so within these frameworks, I'm really looking specifically to see how they integrate public health, equity, and gender-informed languages. And this is being done both through highlighting language, like specific words, as well as that ethos. Like, is there a movement towards this intention? And so there's both like implicit and explicit understandings that we're mapping, that I'm mapping through these different frameworks and policies. I'm also specifically looking at the health pieces in these policies. So is there information about trauma-informed and community-based approaches within these frameworks? And the main reason I'm doing this is really to see, is the response to the individual or their familial responses for children as well. Because we see that the gender-based violence, exiting those situations and accessing those systems are multi-layered and it's very complex, right? We have to think about children, we think about relationships, we think about other financial supports. There's just many, many different factors and different layers of complexity to consider when we're thinking about community-based approaches. So this is one way I also integrate that analysis into my research. I also do comparative international reviews to help contextualize our approaches, our Canadian approaches within global best practices. I really believe in working internationally, learning from each other, and really building strength on tested and proven approaches. Each approach, of course, we tailor and we cater for each specific culture and each specific group in those types of ways. But seeing the what's been done with similar countries and organizations. It's just a wonderful way to share learning and really embed our Canadian practices or link our Canadian practices to more broader information and broader practices as well. And so through this process, I always think about these are the pieces I want to learn. This is what I really want to engage. How do I get from, this point to this next point? And so I thought very carefully about this project methodology. And for me, I really wanted to do a multi-stage and multi-methods in this engagement. And so for this project specifically, I was looking at doing document collection, data coding and analysis, a comparative review, and community consultation. And so the data coding analysis was really grounded in grounded theory. The comparative review looked at multiple different countries across the world. And community consultations were done with groups who have worked with South Asian communities, as well as community safety agencies, trauma-based agencies, provincial and municipal organizations in the health space, and also legal bodies. And so this community consultation was being done to really see and inform the different learnings that I was finding through my analysis. For me, it's very important to have that feedback and that peer review, and also center the lived experience of the folks going through these processes as well. And so for me, I really believe in community engaged and collaborative research. And so this is how these different methods piece together for this specific study. And so some of the anticipated outcomes and impact. Part of this research was really designed to really broaden the policy landscape and provide some recommendations to leadership, politicians, and policymakers around how to strengthen public health violence prevention frameworks. We see at a systems level that these policies really create movement and can create significant change. But we also understand that there are people who are implementing these policies. So how do we get clarity between the policy, what's written, and the implementation of those pieces? How does that translate? So this research is really looking at those kind of procedural and process pieces as well, and being able to center these pieces on community frameworks. And so part of this research as well was designed to really develop practical tools from the community organizations. I heard this over and over from the agencies in the community that we were working with, is really that they want to have practical tools, training, guidance, these kind of pieces, right? So this research was really designed as well to create those practical options for agencies to really create space and create change in this area of gender-based violence. Also, we worked a lot at building academic and knowledge dissemination outputs. In many of the studies that we looked at and the research that we read, it was highlighted over and over again that there are not enough sources of this information or enough resources to kind of explore some of these phenomena and these linkages around what's happening in the South Asian community related to gender-based violence and intimate partner violence. And so for us, it was really important to share this information and get this data out into the community and get it out into the world. And so it's really one of those pieces where we have heavily focused on knowledge dissemination. We also want to continue to build this research through future grant applications and more research in intersectional public health policy. This is an area that we really defined and talked quite a bit about what does intersectional public health policy look like, and what could that how can that translate into making our cities and our communities safer with more responses through public health. And so this was a major consideration of our conversation and our research as well. And some strategies that we learned through doing some of this engagement was really that trauma-informed services, or in many public health settings, they've already moved towards being more trauma-informed. But we saw that this was really taken up very positively by South Asian communities and being able to respond more in gender and culturally sensitive ways. Being able to have a centralized point or a point or a collection of agencies that could respond to gender-based violence or intimate partner violence was really welcomed as well in terms of being able to build this collective momentum for systemic change because it is very, very difficult to speak about experiences of violence, and there's a lot of stigma and fear surrounding it. So, being able to come to a place where folks have that level of an understanding and also have that level of access to different resources in the community and can create those referrals or bring those sources to you in a way that's going to maintain that safety and that trust was very critically important in terms of strategies. And one of the other pieces that I really wanted to bring to your attention today was around just youth engagement and empowerment strategies for South Asian women. It's a different culture. We really work towards trying to build up our capacity and our understanding for just what is possible in this world for us. And so we're seeing more and more to encourage South Asian younger women to pursue their dreams, pursue these different pieces, and break free of violent relationships if that's what they're experiencing. But the bottom line of the study was really that policy redesign must be inclusive and evidence driven. And some tools that we're working on building from the study is really looking at community collaboration templates. So how do I build those micro communication skills to be able to work with different agencies and what is going to be effective in terms of connecting with these different folks? And we're also working at developing training resources for organizations in terms of health and social programs so they can have a base knowledge and a resource to refer to. We're also looking at safety planning and perhaps developing a crisis response framework recommendations because when folks are reporting or seeking support to escape violence, often there is a disclosure that's going on, and safety planning and that crisis response framework is usually the first line of defense. And so that response can create a scaffold or an avalanche of different responses. And so being able to respond at that level, that safety planning or crisis framework level, and having knowledge about how to be culturally sensitive and engage with folks who are disclosing in their moment of need, that is an extreme moment of vulnerability for these women. And so having knowledge and understanding of what that can look like and how they can hold that container for women who are disclosing was really important. And this was something that was really important for the community associations and groups involved in this research, is really to be able to create that safe container, that safe space for women to come forward. And once they do to come forward, that they should not experience more harm at that stage. Lots of the different work in this space as well had not had formal policy or program or policy evaluation templates. And so creating some of those templates or creating a framework for folks to be able to evaluate and document the work they're doing with South Asian communities can really be important as well for us to build capacity and build understanding across Canada and nationally. And then building some of these cross sector partnership toolkits and that digital safety and online harm prevention resources were critical as well. This is a space where we're seeing more and more need that digital safety and online harm perspective, because when we see that women are accessing now the internet or accessing more different types of digital mechanisms, um, that is not always overt. It's not always clear around some of the harm that may be incurring. And it's not as open. And so with that digital safety piece, I'm just sharing more information about how to be safe when accessing digital tools, how we can create harm prevention pieces in online spaces. So this is an area definitely for further exploration, but it's emerging more and more now as a need. And so in terms of gaps, we really need more community knowledge and education in terms of sources and resources. We also need to build more violence prevention design into public health policies and spaces. There is a recognition that we are working in this direction in terms of the public health policy space, but there needs to be an increase of this focus. We also need to be looking more at how we can monitor and evaluate the programs that are designed to support South Asian women through their disclosure and seeking support for health and economic safety. And we need to look at ways that we can create this long-term safety and this long-term sustainable impact. And so we must continue to really advocate for and advance action related to ongoing commitment to evaluation, learning, and policy refinement. So key learnings from the webinar today, and I just really want to highlight these 4 points, is really that violence prevention is a public health imperative. It is something we can respond to through public health responses, and it is an institutional response. We also see that South Asian young women face individualized and intersecting into vulnerabilities. And those two words are critical when we're looking at to develop these systems and systems level and institutional level responses. And so our policies must be culturally responsive, gender sensitive, and trauma informed. And this creates this multi-layered depth and comprehensive understanding of what's going on in this violence prevention space. And so just my last point is around collaboration is critically important as well across academic institutions, health systems, social services, legal bodies, and communities. And this is essential for this cause. And this is why I'm so grateful to the platform of AVA that we're here today. We're most of that we are members of, because AVA is a critical player and a critical part of this collaboration and bringing together multi-sector, multiple sectors and multiple different groups of folks. So I'm really thankful for this platform, and I'm so happy to be able to present some of this research here today. And so just the last quote I wanted to leave with you with was, what you do makes a difference. And when you have to decide, and you have to decide what kind of difference you want to make. And so in the areas of gender-based violence, it's really community-based violence, a community issue. We're really looking at human rights, saying yes to helping women and engaging men in this discussion as well. And so as I leave you here today from this webinar, I just want you to really critically think about and reflect on what type of difference you want to make in this world and in your communities. So thanks so much for your time today. And so I welcome your questions. I know we're going to facilitate a question and answer. This is my contact information if folks would like to connect after the webinar. And I'm happy to connect. I'm happy to meet. I'm going to be continuing to do research in this space, and so I'm happy to water these plants as they continue to grow and we plant them together. So I'm just going to move to the thank you. And I'm not sure, Sarah, if I should move to the thank you for joining us today slide
Yeah,
as
that would
well.
be great. Thank you.
Okay, perfect.
So
There we
quickly
go.
before we get to the Q&A, I just wanted to note for those in the audience that QR code will take you to the surveys, and my colleague Jason will also post the links in the chat momentarily. We'll leave this up for you for a little bit, but please go ahead and take that survey. Let us know how you liked it, and we look forward to your thoughts. And Alicia, oh my goodness, thank you. That was so interesting and powerful, and I so appreciate you. I have a few questions for you, but one that came to mind that I hadn't thought of in advance was about art-based inquiry. I'm so passionate about stuff like art-based inquiry, and I was wondering if you could talk a little bit more about your process and the meaning of it for you and how it informs your work.
Yeah, so it's so interesting for me. I think it goes back to my childhood. I was always really someone who was engaged in art, creativity, putting different pieces together, puzzles, just that component of creation really just spurred excitement and inspiration for me. And so for me, it was really interesting because in the South Asian culture, there is a lot of commitment to arts, fabrics, design, like just being creative in many different ways. And so for me, I really took to that as a strength. As a youngster and in my youth, I kind of built on that through different forms of art, through dance, through visual arts, through engagement in arts. And so for me, I actually got to see the power and the impact of that expression, artistic expression on folks in terms of how they would feel a connection to the cause or feel a connection to the work and really feel inspired to take action. And so for me, I really wanted to harness and mobilize that because I really found that going through my academic career as a master's student, a PhD student, and now as an assistant professor, writing has an impact. Our qualitative and our quantitative data has that impact. But when you add that artistic layer, where people are showing their experiences through images or words or poetry, these kind of ways, It spurs a different part of our hearts, I think, and a different parts of our mind. And so for me, specifically with gender-based violence, where people are experiencing horrific occurrences, right? Like extreme health outcomes, to give them back that power and that autonomy and expressing themselves in their own authentic way. To me, it's been so inspirational to work with the community and see them express themselves this way. So
I've always found art-based inquiry to be so powerful, not just because it's underused, because we are so tied to that old way of knowing in the academy, but also because I think it gives voice to people who wouldn't be able to find those words otherwise, but can express through art, through alternate ways of knowing and being. And I think it's really beautiful, and I'm just so excited that you do it in your work.
yeah.
Let's see, sorry, I did have some questions prepared and then I closed them out.
Oh
Um,
no, that's okay.
So I was thinking about your presentation, and one of the questions that always comes up for me is when we talk about these really powerful things and different ways of knowing. How do you think that policies here or even internationally could be adapted to better protect South Asian women and those who are survivors of IPV, GBV? Like, what does your research say about what we can do, either like at the governmental level or these smaller levels like community-based organizations?
Yeah, yeah. That's a big question. I'm going to
It
try
is.
to kind of break that
I
down
usually
into
ask big questions.
a few different pieces. Like in terms of some of the policy approaches, we see that we do need direction in a certain direction. Some of the policies we've been analyzing are they have a generalized component, but then also like a directive guidance framework of some sorts. And when we see that the policies are developed, often they will kind of speak to Black, Indigenous, and racialized groups as like one kind of component at that stage. There are some that are more differentiated and more specialized, but then when we hone down into more of the racialized components, we do see that some of the cultures are not as equally reflected. Um, and so that can be really difficult, I think. And so what happens at the federal level is like we have those kind of areas to explore in. And then when we distill down into the provincial and the municipal level, folks have more opportunity and capacity to then build on those policies with more guiding frameworks and different pieces. So you see across Canada that different areas like have taken some different approaches. And so areas which have more diversity, cities versus rural areas, they become more specialized based on their specific communities. But one of the main challenges is that those directions and those intentions are there in the policies to provide that protection, provide funding for that prevention pieces. But in terms of the operates like how that's operating and taken up in terms of implementation or programs, that's where sometimes the difficulty is because there has to be not just the policy ability and capacity, but the training in terms of how can I shift this guideline to support individual folks who are coming to report or to disclose, right? So they have the standardized protocols in terms of how they're responding, but then that kind of training and that linkages around how folks can maybe have different responses or more individualized approaches. That's where some of the difficulties are, you know. So that's why we see when different folks are reporting gender-based violence that their plan or the services they receive or the path they were guided to follow are very different in some different ways, you know. And so that can be the most difficult piece, I think, in terms of how we take that up in the terms of community-based work and then through the organizations. And I think one of the major approaches that can help us redress this is to work more cross-sectorally, like cross sectors, to kind of better understand, like, okay, if someone calls, what's happening here? You know what I mean? So how can we design more collaborative or like intersectoral pieces? And so I think in terms of like policies and systems, we need to humanize our systems and work more together as people.
Absolutely, yes. And I mean, the funny thing is, those seem big, but also so practical and so common sense, and we just haven't done them yet, by and large. So well said. Thank you. And I'll leave the Q&A open for just a couple more minutes in case audience members want to jump in. But the last question I have for you is like, when we do research and yours is so great. I love the art-based inquiry. I can't stop raving about that. When we do research, there's those moments for us, either big or small, where we're like, wow, that's amazing, that's powerful, or I didn't really see that coming. That's so cool to learn that. That's different. What was one of those moments for you when you did this work?
Yeah, and for me, it was deeply motivating, but then also deeply unsettling. I'm actually writing a research article about this right now called When Her Story Meets Mine,
Mhm.
because there were so many different disclosures where are either cultural heritage or like some commonalities were being shared in the research. And when we think of research being objective and neutral, when we move into these spaces where we're working with women with shared lived experiences, those intersections are inevitable, and that neutrality is very difficult to maintain. And so for me, through this research process, I had to journal quite a bit. Um, because I feel like I had to journal quite a bit, and I experienced a few different processes, which I'll share in the article, but it was one of those pieces where I really had to kind of understand when someone is making disclosure to make sure that my research ethics were really supportive and kind to somebody, because when folks would be talking about their experiences, there in many cases there was some emotion displayed, you know, and when we're working together as different folks, I really try to kind of normalize those power dynamics, right? Or kind of create a space where we're together in research and holding kindness and compassion in that space as well. But there, I had many, many profound moments of just growth and learning going through this research with the women in terms of my use of self as a researcher and the different tools I engaged as a researcher. So for me, I actually, it was transformative for me to write about it and really kind of talk a little bit more about how my use of self in research affected the research. Yes.
I think that's one of the beautiful parts about like methodological inquiry around that is I think methods come to life when we
Yes.
have those kinds of things.
Yes, very much so.
Well, thank you so much. I don't see any Q&As coming in, so thank you truly for taking the time and sharing your expertise with us. I'm so incredibly grateful, and I look forward to reading your article.
Oh, thank you so much, Sarah.